Hello everyone. Welcome back to our health and nursing education session. I'm so excited to have you all here today. Alright, today we're diving into meningitis. By the end of this session, I promise you understand meningitis inside and out. The types, the causes, the symptoms, and most importantly, how to manage it as a nurse or healthcare provider. So, what exactly is meningitis? Meningitis is simply the inflammation of the meninges. These are the protective layers that cover your brain and spinal cord. Imagine them like a cushion or a shield of your brain. Now, when these meninges get inflamed, whether due to bacteria, viruses, or fungi, we call it meningitis. And it's no joke. Depending on the type, it can lead to fever, neck stiffness, seizures or fits, and even confusion or unconsciousness. We can classify meningitis based on what's causing the infection. Let's break it down. Bacterial meningitis, viral meningitis, and fungal meningitis. First up, bacterial meningitis. This one is serious and life-threatening if not treated quickly. Now, how does it spread? It spreads through airborne droplets like sneezing or coughing. It also spreads through direct injuries like skull fractures. Not only that, it can also spread from infections like pneumonia or even a rotten tooth. Once bacteria invade the bloodstream, they can cross the blood-brain barrier, and that's when things get dangerous. The inflammation causes swelling in the brain, blocks the flow of cerebrospinal fluid, and increases pressure inside the skull. This explains why patients get severe headaches and neck stiffness. So the signs to watch for are rash, especially in meningococcal meningitis, Koenig's and Brudzinski's sign, also confusion, restlessness, seizures, fever, vomiting, and also photophobia. Okay, so how can we manage this? So the first thing is isolation, specifically respiratory isolation. Then we can give intravenous antibiotics like chloramphenicol, benzylpenicillin, or cefotaxime. Antipyretics like paracetamol can be given for fever. Then we can also add supportive treatments like steroids. Specifically, we can look at dexamethasone. Okay, mannitol we can also give to reduce the brain swelling. Diazepam also for seizures. So the nursing care includes preventing complications, monitoring input and output, providing comfort, and educating the family. So a quick question for you. Why do you think we limit fluids in these patients? Type your answer in the comment section below. Now let's talk about viral meningitis, also known as aseptic meningitis. This type is actually the most common, but thankfully it's usually less severe and can resolve on its own. Viruses like measles, herpes simplex, and even polio can cause it. The virus spreads through the respiratory tract, bloodstream, or direct injury. Signs are similar to bacterial meningitis like fever, vomiting, neck stiffness, headaches, and sometimes seizures. So, treatment for viral meningitis focuses on symptom relief. So we have acyclovir for herpes, then we have paracetamol for headaches, and vomiting meds like promethazine, mannitol, and steroids if swelling is present. Then when it comes to nursing care, you need to remember that you have to keep the patient comfortable and calm, monitor the vital signs and consciousness, explain to the family that viral meningitis is usually not fatal and often resolves. Okay. Finally, let's look at fungal meningitis, especially cryptococcal meningitis. This type mostly affects people with weakened immune system, like those with HIV and AIDS or those on long-term steroid therapy. It can also affect people exposed to pigeon droppings or eucalyptus trees. The fungus invades the brain's protective layers and causes swelling and increased intracranial pressure. So the signs and symptoms are almost identical to bacterial meningitis. We have headache, blurred vision, fever, neck stiffness, vomiting, and also confusion. Okay, let's now look at the treatment for fungal meningitis. So the main drug that we give in fungal meningitis is amphotericin B, okay, which is sometimes combined with fluconazole for weeks. Nursing care focuses on monitoring intracranial pressure, providing fluids carefully, preventing complications, and educating both the patient and the family. Okay, so before we wrap up, let's quickly go over the possible complications of meningitis. That is across all types. So we have hydrocephalus, brain damage, hearing loss, visual impairment, paralysis, cerebral edema, seizures, and in severe cases, death. Always monitor your patient closely and educate the family well. Alright, that brings us to the end of today's session on meningitis, which is bacterial, viral, and fungal. So before you go, please do me a favor, like this video if you found it helpful, comment your thoughts or questions below, and don't forget to subscribe and hit that notification bell so you don't miss the future sessions. Thank you for spending your valuable time here with me. See you in the next session. Stay safe and keep learning.